Hello everybody, welcome back to the channel. Today we're going to be talking about another nutrition video. This one is going to specifically be talking about fiber as our fourth macronutrient. We did a video earlier about our other three main macronutrients, that's protein, carbohydrates, and fats. Dove a little bit into that in terms of how it relates to maybe our weight loss journey or even just overall health. In today's video, we're going to specify or specifically talk about that fourth macronutrient that I consider a macronutrient. We might get a little bit of pushback in terms of fiber being a macronutrient, but I just like to categorize it as a fourth macronutrient because I like to promote a more whole food based diet that specifically integrates fruits and vegetables into our diet to live an overall healthier life. And we can start to see how fiber actually impacts the greater scope of our overall health when it comes to cancer, when it comes to cardiovascular disease, diabetes, and things like that. So yes, I do like to consider fiber a fourth macronutrient and try to program that into our nutritional plan or diet plan, whatever it is that we're working on with you, and just give a little bit more information about that in today's video. Fiber, what exactly is it? Now, fiber is primarily sourced from plant sources, right? So if you think about certain vegetables that you're familiar with eating, most likely there's going to be a fiber content attached to that. Now, fiber does a couple things to our body, more specifically insoluble fiber. That's the fiber that we cannot digest because we do not have the enzymes to break it down, right? Because we can't break it down, however, that actually does give us a positive benefit to our gut health. Now, in the health and wellness space, even in the autoimmune space, on social medias and whatnot, gut health has become a big sort of buzzword, right? But when we're talking about fiber and its relation to gut health, it's very clear, it's very distinctive how important fiber actually is to our overall gut health and gut microbiota. That's the microorganisms and bacteria that populate our gut and help with things in regards to immune system health, possibly helping with autoimmune conditions, helping manage those conditions rather, as well as other things that are a little bit more serious potentially, like cancer. So when we have this insoluble fiber, this is the fiber again that we can't break down enzymatically, that fiber is essentially feasted upon by those microorganisms, by our gut microbiota. Now that gut microbiota is going to feed on that insoluble fiber and help promote that good gut bacteria that's going to proliferate and stay healthy and keep it in that good healthy range of that good microbiota that we need. Now, when we start to alter that, when we start to not have enough fiber, when we start to overload our body with certain chemicals, antibiotics, pharmacological agents, things like that, we can actually mess up the gut microbiota and certain microorganisms and bacteria that populate our gut that are essential for our immune system, that are essential for our digestive systems to extract all the nutrients and things like that from the foods that we are intaking. So it's very important to keep this gut microbiota happy, and one of the ways to do that is through getting enough fiber intake in our diet. Now, why do I stress this so much? Kind of mentioned it a little bit earlier. Now, one of the biggest risks for people as we age is a lot of lifestyle conditions, a lot of things that are related to obesity, such as cancer, such as cardiovascular disease, such as type 2 diabetes, dementia, Alzheimer's disease, things like that, things that a lot of people are scared of, and can potentially trace some of these conditions to also correlating with a lack of fiber intake, right? Now, that's a little bit of a stretch comment to make, but if you kind of follow my logic here, it can make a lot of sense. Now, when we look at people who have these conditions, obesity-related conditions, a lot of the times you can look at their dietary habits and kind of make that estimation that they're not getting enough fiber in their diet because they're traditionally pushing towards less satiating foods, more processed foods, oftentimes overeating and being in that calorie surplus for too long, and that's going to rapidly increase the weight over several months and even several years. And then we combine that with the general lack of activity to be a recipe for disaster. Now, if we take that prototypical model of someone who doesn't get the greatest nutrients in their body, doesn't pick the right food choices, and just chronically overeats, you can see how fiber is most likely not going to be the thing that they're focusing on in their diet. Vegetables, fruits, things that we know to be healthy that have plenty of antioxidants, phytochemicals, and phytonutrients, and other things that help with oxidative stress, that help with anti-cancer proponents in our body and our immune system, those particular people are going to be missing this particular macronutrient, this fourth macronutrient that I'm proposing. So now, when we're on the concept of cancer, fiber does an excellent role in preventing specifically colorectal cancer, right? That's cancer of the colon and the rectum, which is actually one of the top leading causes of cancers in men. And colorectal cancer is actually a very, very common type of cancer for people to get, right? That's why after a certain age, especially for men, we want to get colorectal exams. You want to get your prostate exam because the risk of cancer as we get older increases, right? Now, there's obviously a variety of reasons as to why cancer potentially can manifest in the body, but fiber does a great job, and it's been heavily studied to show the decrease in likelihood of developing certain cancers, which overall just improves your health. And that is something we want to focus on. That is something we want to promote. That is something we want in our standard American diet. We want a higher fiber diet approach. Now, this is not to say that eating, anything outside of plants and vegetables and fruits is bad, but there needs to be that balance, right? You can't just have a diet strictly on meat and carbohydrates all the time, especially if they're processed meats and processed carbohydrates, lots of added sugars and things like that. We want to also balance that with fruits and vegetables and something with a higher fiber content, which is why I'm pushing this fourth macronutrient category in fiber, because the more fiber we have in our diet, typically we're going to be a little bit healthier, we're going to make healthier options, and we're overall most likely going to be eating healthier foods. Now, how does fiber impact type 2 diabetes? Well, again, when we are aiming to eat foods with higher fiber content, again, looking more so at fruits and vegetables, that's going to do a couple things, right? One, it gives us the ability to become more satiated. When we have lots of vegetables, they're typically lower in calories, they're typically lower in the other macronutrient guidelines, lower protein, lower carbs, lower fats. However, if you have a big bowl of broccoli, that's really only about 50 calories or so, but it can fill you up pretty rapidly. Now, if you add that on top of a high protein diet with, a lean meat being your main protein source with a little bit of carbohydrates on the side, you have a complete meal with all four macronutrient categories, but your satiety levels are going to be a lot higher, meaning you're going to feel full longer and quicker, and thus you decrease the chance of overeating and being in that calorie surplus. Now, on top of that, with the satiety levels, fiber also does a great thing of dulling or kind of decreasing the rapid insulin response that we get when we eat sugar or eat carbohydrates, right? So if we have a meal that's, a lot of rice or a lot of sugars in it, if you have fiber, it actually helps decrease that insulin sensitivity and that large spike in insulin that we may get if we don't have fiber. So overall, we're getting a slower release or overall we're getting that slower release of insulin into our bloodstream, and that's overall going to be healthier. That's going to help the pancreas, which is the organ that secretes our insulin, to be a little bit more receptive, right? When we talk about hormones, the general gist of it, for the most part, I'm sure there's a few exceptions out there, but for the most part, when a hormone has these large spikes, you're generally going to make the receptors, the organs or the places that are receiving that hormone from the blood, you're going to desensitize them. And what that does is that leaves the blood high in sugar, which will lead to inflammatory issues, and then eventually, atherosclerosis, cardiovascular disease, etc., etc., etc. Now, type 2 diabetes, by the definition, is an insulin insensitivity, meaning the receptors have been so overloaded that they can no longer function properly. And there's too much blood sugar in the body at that point. Now, in order to decrease the risk of developing that and thus developing type 2 diabetes, we want to ensure that we're eating a diet high in dietary fiber, maybe watching the sugar intake that we're getting, providing a high lean protein source as the forefront of our diet, and also making sure that we're exercising, right? But for the gist of this video, high dietary fiber is a very important key in the reduction of type 2 diabetes. The take-home message for today's video is just to increase our fiber intake. Now, when we're talking about fiber intake, because I'm considering it a macronutrient, there should be a particular range of grams that we should be getting per day, right? If we talk about protein, we can talk about how much your body weight affects how much protein you should be intaking, and thus carbohydrates and blah, 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 and we have our macro split, right? When we're talking about fiber, there's a general guideline for most people to get to, right? If you fall into this category where you're not really consuming a lot of vegetables on the daily, you're kind of just skipping out on it with each meal, the first goal is to not even think about the grams that you're getting, just include any and every type of vegetable that you're willing to take. Any vegetable that you like, or even mildly like, just start intaking that, because more than likely you're under eating in the fiber aspect, and any type of fiber at that point is going to be beneficial. Now, if you are eating fiber but you're not sure how much you might be needing, it's a little bit different for men and women. For men, anywhere from 35 to 50 grams of fiber is a good place to start. For women, anywhere from 24 to 35 is a great start for our fiber content. So again, aiming for a higher fiber content diet, typically a whole food-based diet with plenty of variety in fruits and vegetables. A good rule of thumb when you're eating more vegetables is what I like to call eating the rainbow. So vegetables come in all sizes and all colors. You typically want to have that scale of, your orange colored vegetables and fruits, your reds, your yellows, your greens, your purples, etc., etc., etc. Mix it up, have that variety. Thank you guys for watching again. We'll see you in the next video. Take care.